Hello everyone, my name is Tania Davies. I'm the Success Slow Coach, speaker, trainer and therapist, and the owner and founder of the Mindful Impact Wellness Hub up in the Adelaide Hills in South Australia. Today I'm joined by Dr Olivia Ong. Dr Ong is the heart-centered doctor. She's a medical leadership coach, pain physician, author, speaker, and has a thriving medical practice in Melbourne, Australia. Welcome, Dr Ong. How are you?
Thanks for having me, Tania. I'm well, thank you.
Good, good. Now, at the moment, you are in lockdown in Melbourne again.
Yes.
So you are going slow, hence the theme of the entire series that I've been talking about. But today we're going to get a little bit deeper into the idea of the heart-centered doctor. So tell everybody, what is the heart-centered doctor?
Yeah, my company, the Heart-Centered Doctor, who that's my identity and my brand identity. To me, a heart-centered doctor means someone who speaks from the heart and someone who embodies very heart-centered, practice. Mm-hmm. Someone who embodies, heart-based characteristics like self-compassion, mindfulness, and gratitude. So just elaborating a bit about self-compassion.
Yeah.
If the audience doesn't know what self-compassion is, it's essentially three things. The first thing is just being mindfully aware that you are either stressed out or you're suffering or you're feeling overwhelmed. Mm-hmm. And the second part of self-compassion is connection, meaning connection with yourself, as it with me,
yeah,
and other people, the people around me. And the third component, which is probably the most important component, is self-kindness. Now, self-kindness in theory sounds really like simple, right? Like just be kind to yourself, but
yeah.
when you start to accept love into your heart, the thing that will sort of come up will be the ego or inner critic will always try to trip you up and go, oh, do you even deserve love?
Yeah.
Do you even deserve all this kindness that you're doing to yourself? Like, you haven't even achieved this, achieved that. So the ego will always try to trip you up. So this particular self-kindness, it's easy to intellectualize, hard to practice, but it can be done. People might be surprisingly feeling quite uncomfortable and sometimes quite, because people are, like most of us are used to numbing our emotions, and when feelings of love come in,
absolutely,
it's just really hard to.
I get a lot of people in my clinic that are just numb to the world now, and it's a survival tactic. We both know that. There are times when it is appropriate to numb ourselves to survive in that moment, but the work we do, we have to bring them back. So I'm really curious to start introducing your story to our audience today, because it's an amazing story. So if you could just tell me, like, how did the universe decide to slow you down, and how long ago was that?
Okay. So in 2008, when I was a junior doctor, my life changed forever. I was actually forced to slow down for good. So I was walking along the hospital car park on the way to work when I was hit by a car at very high speed. So it was a near fatal accident, and the impact of the accident rendered me a paraplegic. I was transported by ambulance to, a tertiary trauma center in Melbourne that same day. And I had emergency spinal surgery. Essentially, my back broke in half, literally.
Wow.
At L1, L2 level, which is like the lower back area.
Yeah.
So after the surgery, I couldn't move or feel my legs. Even during impact, I couldn't move and feel my legs either. And that's what we call spinal shock, which essentially, upon impact, the blood supply to the spinal cord is cut off. Yep. So and of course the spinal cord is unable to function, and hence I wasn't able to feel or move my legs. Even after surgery, the spinal cord does take a bit of time.
Yeah.
To get back some of this blood flow, get back in terms of recovery. I was in a wheelchair for a total of 2 years. My right leg was really weak, so I couldn't stand up. I couldn't walk. But one day I heard about this particular recovery center called Project Walk, which is, this is in the United States, San Diego.
Okay.
This particular recovery center helps spinal cord injury survivors learn to walk again.
Yes.
So I thought, I need to give myself a chance to do this, because I will regret it if I don't. Because
Absolutely.
the longer you leave spinal cord injury unattended or not fully recovered, it's just the recovery would just take a long time.
Yeah.
So I did that. I packed my bags and my husband came along with me, and we spent about a couple of years in San Diego in project work, in fact, training Monday to Friday, 9 to 5, literally 5 hours each day. And then
what a commitment.
Yeah, but I was so determined to learn to walk again because I felt that life really did shortchange me, and I thought I need to get back to walk again. But I thought that, you know, even though I thought walking was my primary aim, but I got back a lot more out of that journey to walk again. It forced me first to slow down, and boy, didn't my body really needed to slow down, because before my injury, I was, you know, really close to burnt out, and I was really exhausted.
So that leads me on to ask you, what are some of the key things that you learnt during that time that our listeners would be really interested in that slowing down process?
Yeah. So essentially what I had to learn to do, you know, in the process of learning to walk again was to, you know, learn to just think about a baby that they have to crawl, kind of sit up and then stand for a little bit and then walk a bit wobbly, a few steps. And then after that, really walk again, like walk properly.
Yeah.
So essentially, like, you know, the accident really did force me to slow down in that way, because
literally
I was forced to learn to, I guess, learn to walk again like a baby. Like I had to crawl with my trainer forced me to do stuff like learn to crawl again, sit up and then stand for a short period of time and a long period of time, and eventually taking a few steps and then subsequently walking around the gym unassisted meaning that the trainer is just there to watch me, but not like lay their hands to help me, kind of thing.
How long did that process take from the crawling to getting back up again?
Oh, it took me about 3 years to get that. Yeah, it took a long 3 years and with intensive therapy as well, Monday to Friday, 5 hours each day. So
you are one dedicated woman. I love it. I mean, not even close to your story, but I've had to learn to walk 3 times in my life thanks to knee operations, knee reconstructions. And the thing that I picked up during that time, like you're saying here, is the simple message, the command of sending a command to your leg to move wasn't happening anymore. Exactly. And so you bring back that absolute respect for the fact that you've learnt to climb some pretty big mountains in your life, and you didn't know it at the time because you're a baby learning to walk and talk. But the gratitude you have for those lessons that comes through, have you found that?
Yeah, in the journey of, you know, slowing down my life, and that for that period of time, I just learned to smell the roses. Literally, I immersed myself in American life. You know, I hung out with, you know, mostly Americans, because I mean, it was in America, in San Diego, and a lot of the bulk of the clients who are in project work are mainly from, you know, mainly Southern California, because that's where it is in San Diego. But I got to meet, you know, other spinal cord injury survivors from all over the United States, Canada. We even had international clients as well, like Japan, Brazil, Mexico. I remember quite interesting conversations with a guy called Rico, and he was from Mexico, and he was like a drug cartel type of thing. He used to do that, but like obviously he had to slow down and not do that anymore. So it slowed him down and slowed me down as a doctor. So that was hilarious. I thought, I thought that was amazing.
It's great perspective, isn't it?
Exactly. And he was also very determined to learn to walk again. Like, can you imagine this amazing place that unites, you know, healthcare professionals who are, you know, who have spinal cord injury, drug cartel or ex-drug cartel people, or people who are like, from different walks of life, not necessarily drug cartel, different walks of life, you know.
So I'm really curious to know now, after everything you've been through and the transition you've made to be working with doctors now and helping them ultimately slow down as well. Why do you think the people you work with, the busy professionals, struggle to slow down?
Oh, good question. I think my peers use busyness as a badge of honor. It is to them, because the busier they look and they feel, they think they're in control, that they are actually big, you know, like, I'm actually really competent at what I do, I'm really amazing. But little did they realize that that's a spiral down towards burnout. Just that wearing busyness as a badge of honor. Also, doctors tend to, use busyness to hide difficult emotions as well, especially them experiencing what we call vicarious trauma, where they, so.
Yeah, I've had a great speaker on here about vicarious trauma. It's quite significant.
Exactly, and doctors do experience a lot of that, and they use busyness to just numb their vicarious trauma response, basically. And those are the two main things that my peers do to not slow down. In fact, they use busyness as a.
So with all the experience you have now in helping people in that space, what would be your key advice to them to help them start that slow down journey?
I think to get them to recognize that busyness is actually to their detriment will be to actually get them to be aware of it. A lot of them are actually operating at a level where they're not even aware that they're using busyness as a badge of honor. So that's why I'm really passionate about, educating my peers or, doctors in general about burnout. What are the early warning signs and what are the late signs? Because more often than not, a lot of doctors, once they only seek help once the burnout is really severe. By that time, it's way too late. It's all the mental health issues, sometimes suicides.
So I get to see them at that point.
They probably come to see you at the later
paramedics,
stages.
Firefighters, they're in my office.
Exactly.
Yep.
Prevention is key for me. That's the key. That's the aim of my work is burnout prevention rather than burnout recovery management, which is sometimes too late.
Yes. Yeah. Oh, yeah. I hold out hope for any of them. I really do. And so I'm curious now, what are your personal strategies in making sure you don't head towards that burnout now? Because you've got so much going on. You've already got one book, you've got another book on the way, you're a coach, it keeps going on. How do you prevent yourself? What are your strategies from heading towards that burnout?
Yeah. So I've got a strategy care plan for my burnout because I've been through burnout myself.
Yeah.
In 2019, and over the last 2 years, I've learned lots of different strategies to kind of manage my own burnout. So I kind of formulated a plan in my head. So very important thing is to have some self-reflection time in the morning, or that's for me, when the kids are asleep and the whole house is asleep. I usually do like a meditation practice, about 10 to 15 minutes with mindfulness. I like guided meditation because it just keeps me not distracted because I get easily distracted. So a voice to guide me throughout the meditation is great. I find journaling quite helpful after that to write down reflective moments into my journal. And I try to do pockets of meditative practices throughout the day.
Beautiful.
And meditation doesn't mean that you have to kind of, sit down in a cushion.
The lotus position,
No, you can just for me, in between patients, if I have a gap, I'll just rest my mind and not think about anything, close my eyes. Sometimes I do that. And another practice that I do, which I preach about it a lot, is self-compassion. So in times where I can catch myself in that state where like over the weekend, I had to sit this we call it medical legal exam, which is like, I want to do a lot of medical legal work and I have to sit an exam over the weekend. Boy, I was really hard on myself. When I got one, I think I had to get 100% for that exam, and I got one mistake. Boy, I was really hard on myself. But I immediately caught myself and go, hang on, you're back there again. So it's to normalize it.
Absolutely.
And saying, hello, you are doing that self-criticism thing again, self-judgmental thing again. Hang on, let's take a step back.
Catching your patterns there.
Exactly. Well, and I do an anchoring practice where I just put my hand on my heart, literally. That's what I do. And it just grounds me. And I'm okay again. Well, I didn't come with this practice really easily. It took me 2 years to master it. So it's not
as a reformed perfectionist, I hear everything you say.
It's not easy. All this heart-based tools, like in theory, they're all really easy to understand, but boy, practice.
But it's a muscle, right? The more we do it, the easier it does get. You can start lifting those weights that you want to.
So
I'm curious because we all muck up in our worlds. I'm quite well known for it, and I'm quite proud of my mistakes. I'm really interested to know that with everything that you do know, what do you find to still be your greatest challenge in slowing down?
I think the greatest challenge in slowing down will be because I'm someone who, once I get into a task, I really immerse myself and I can get quite lost and caught up in it. So that's still my biggest challenge. Even right now when I'm running my business, the Heart-Centered Doctor, especially things that I have to learn that, like things, for example, systems and processes like setting up a acuity calendar, things like that. I get, because I'm so determined to get this sorted.
Yes.
But before I know it, I'm doing that for an hour. And I didn't realize that I can actually outsource this to a VA or something like.
Yes.
But there's that perfectionist, I guess, in me that goes, I want to get this done my style because I have achieved it.
Yeah, that determination of yours. Yes.
Exactly. I think now I am catching myself doing that earlier and then after that, and then I can kind of go, okay, maybe this is something I can delegate.
Yes.
I can do it. Doesn't mean I have to do it. If I get someone else who is really techie savvy to do this, I can focus my energy in other things. Yeah.
They may well do it better.
Yeah, they usually do
the
it
painful part.
And I'm like, wow, that person probably took like 10 minutes, whereas I took an hour.
Exactly. And your time is precious to those that need you, especially as a pain physician. There's a lot of people out there that need you. So I'm curious, it absolutely beautifully leads on to one of my next question.
Yeah.
And in terms of leadership, I mean, you are a leader in your industry, and I'm curious to know what would be your message to leaders out there in any industry about the concept of slowing down and bringing in conscious leadership into the workplace, that compassion that's really needed there. What do you think the business would benefit from having a leader who is actually consciously aware and compassionate?
I guess if I were to just put on my doctor's hat for the time being, I think if a doctor is able to show self-compassion, that means that he or she will be able to show self-compassion for others, others meaning patients and colleagues. So similarly, it translates exactly the same as a business owner. If they consciously practice self-compassion, then they will be able to show compassion towards their clients or towards their team members, like in whoever they're working with. And I guess, working one-on-one, can be quite challenging in a sense that it's quite a lot of energy expenditure, and the burnout rates, I guess, with one-on-one can sometimes be quite high.
Yes.
But I think in this case, when my advice to business owners out there, if you're a service provider, and especially in the coaching space or counseling or consulting space, if you're doing a lot of one-on-ones and you find yourself kind of spiraling down that burnout rabbit hole, self-compassion a self-compassion practice would be very helpful.
Yes.
Even like taking 10 minutes of your time doing self-compassion, which essentially involves, like I've said, Tania, just putting your hand on your heart.
Yeah.
Take 3 deep breaths, because the actual act of putting your hand on your heart actually activates the soothing system. When you hug a baby and just all oxytocin, well, that's the hormone when.
Yeah, that's right.
The lovey-dovey hormone.
Oxytocin, yes.
Yeah, the lovey-dovey hormone when you hug someone or a baby or a child or a loved one, and that's the feeling you get when you put your hand on your heart. So that's my encouragement for business owners who are struggling to speak, struggling to manage their energy, and they're finding themselves going down the burnout rabbit hole. Put a hand on their heart. If they're finding hard to be, I guess business owners, some of them find it hard to be visible on social media, afraid of judgment and things like that. Put your hand on your heart, and that practice can help. I did it. I was really fearful of visibility very early on in my business, but now I'm like, if someone doesn't hear my message, that person will not get help, and that person will spiral down a rabbit hole of burnout that he or she cannot get out of. And that's even more devastating than my fear of visibility. So that's why right now I'm just just getting myself out there and getting the message of burnout.
That's right. I mean, ultimately, we've both heard from in the coaching realms that the idea that the person at the other end of the phone or the camera or the other end of the coaching call right now, they are more important than your fear of being on a camera or one-to-one. Yeah. Exactly. When you can put them first, then there's no problem. You don't care whether you're everybody's cup of tea or not, so to speak.
Exactly. Yeah. Haters are just going to hate anyway. Like,
absolutely.
According to Taylor Swift, that's what she said. But sometimes
Thanks, Taylor.
and sometimes we learn from great philosophers like, Taylor Swift, John Bon Jovi has a lot of very great philosophies.
Absolutely. Yes.
And yeah, and she's right. Haters are just gonna hate. So
yes.
don't be scared to be visible on social media, because haters are just gonna hate. Literally.
And there's too many people out there that need our help. Yours, mine, everyone in the helping space. They need us, just like we need each other. So thank you so much for being there for those helpers that are out there as well. I couldn't think of anything better than a compassionate and heart-centered doctor. So thank you very much for leading that journey.
No problem,
and
Tania.
If any of my listeners today would like to personally get in contact with Dr. Ong, and you are releasing a new book, that's correct?
Yes, that's correct, Tania.
When's that coming out?
So that book is coming out actually next week.
Oh, what's it called?
It's called The Heart-Centeredness of Medicine.
Beautiful.
I wrote this book purely because I've just seen way too many of my medical peers burn out, and I've been one of them too. So I wrote this book to teach, doctors, not I think doctors, I think healthcare professionals, business owners, entrepreneurs will benefit from my book.
I can't wait to see it.
Teaching all of you heart-based tools, just to get more heart-centered with life and business in general.
Beautiful. Well, if anyone wants to get in contact with Dr. Ong, all of her details will actually be in the descriptions. Please, I'd like to thank you again so much for sparing your afternoon with me today.
No problem,
and
Tania, pleasure.
We'll be in contact very soon. Take care, everyone.
All right. Bye, everyone.